the first piece is that, when we think about Ontario Health Teams and the mandate for Ontario Health Teams around population health and integrated care, population health and improving value really means both the health of the population and equity. And I've skipped the slide, but maybe you can imagine it. I'm sure it's going to be up in the next couple of events, where we think about population health, and what we need to do is both shift the curve and improve population health, and also squeeze the curve, which means that we are bringing the different ends together by bringing up those people at the lower ends of the strategy. And I think there's a new strategy in the NHS called 25, where they're focused on the 20% of the population, that bottom quintile, and improving care. And I think in the next few months, we'll bring some people in from the NHS to talk about some of the work that they are doing. But some of the takeaways here is that, first off, there's considerable variation across Ontario Health Teams in the distribution of the attributable population in the areas of low to high material deprivation. Every OHT is not facing the same population. The equity measures in the patient surveys are also showing some important issues related to the social determinants of health, and particularly also social isolation. The equity measures in the provider surveys are a little less striking, but smaller sample sizes means we still have relatively little information. And so I'd encourage us to continue to pursue this. And within OHTs, we are happy to support our provider survey through the online tool that we have made available through REDCap as well. So it is a secure environment. And we have from our website ways that you can go in and look at the provider patient surveys and think about how you can collect that information individually. Some of our kind of key takeaways here are that social determinants of health are substantial, and they are statistically related to patient-reported experience and outcomes in that survey. So we need to be cognizant of this. And so today, our starting point is measurement, and we're just saying that's what our measurement is telling us. Some of the measurement proxy measures that we have, like maybe ED first, they have less association. Some of them do, but not all of them. And then the measures of health outcomes, such as premature mortality, tend to have higher associations with area level deprivation, and that lines up also with the patient-reported outcome measures. Healthcare cost itself was moderately to strongly related to area level deprivation, meaning that if you have more deprived neighborhoods, it's costing more to care for those people. I think there's two things to think about there. One is continuing to meet those needs because they're higher needs patients. But the other thing is also, like, what are the other determinants that aren't healthcare that are affecting those individuals and then their health-seeking behavior as they have greater needs? And that's, I think, where we really want to get the conversation to as we evolve over the next couple of webinars and, over the future of Ontario Health Teams. And finally, just our provider experience has some, but relatively in our sample so far, variable associations with individual sociodemographic measures across the different groups.